Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. I'm here with Dr. Zahra Figueredo. Hello, doctor. How are you?
Hi, Louise. Very good. Thank you so much for having me. I always look forward to talking with you.
This is going to be a very interesting podcast because today we're going to talk about the stem cells by itself. The topic will be stem cells, and the most common question that people they're asking themselves is, what is the stem cell? What is a stem cell? Doctor, tell us, what is a stem cell?
That's a very good question, Louise, and it's interesting because you hear that term thrown around in the news and in medical terms and medical conversations and things like that, and people don't really understand what a stem cell is. Basically, what a stem cell is it's a very primary cell that has the ability to regenerate itself and to become, after stimulated, to become almost any tissue in the body. Okay, so basically, the goal of a stem cell is to regenerate itself in order to regenerate a damaged tissue or organ or whatever the case might be. That's basically what a stem cell is.
I see. And what are the different types of stem cells that we have?
That's another very good question. So there are autologous stem cells. Those are stem cells that are from the patient's own body, auto meaning self. And then there are allogenic stem cells that are taken from other sources. Now, the types of stem cells that are usually used for regeneration purposes are adult mesenchymal stem cells. In some cases, embryonic are used. However, that's a very controversial topic and type of stem cell because of the capacity for embryonic stem cells to sort of grow uncontrollably and possibly cause cancers and tumors and things like that. So we at the Stem Cell Healing Institute do not use embryonic stem cells whatsoever. We use only adult mesenchymal stem cells that have a lifespan of several years, and then they die, which is what we want. And adult mesenchymal stem cells have the capacity to regenerate themselves and regenerate damaged tissues and organs and nerves and cartilage and things like that. So those are the types of stem cells we use, and they can come from bone marrow, they can come from adipose tissue, they can come from umbilical cord, blood, and also endometrial stem cells.
Why are they so useful for different treatments?
You know, that's basically what stem cell treatment and stem cell therapy does is when there is a disease condition, we have the capacity with stem cells to cure the disease or the condition or the damage or the injury, whatever it might be, because what stem cells do is they correct and basically they correct a disease or a condition or an injury. So if there's, for instance, damaged cartilage, the stem cells can go in and literally regenerate and rebuild that damaged cartilage. If there's an autoimmune disease where the immune system is damaged, the stem cells can go in and correct the autoimmunity, the antibodies that are attacking itself, which is what an autoimmune condition is. The stem cells can go and correct the immune system so it stops attacking the body. And so that's basically the capacity of a stem cell. It goes in and corrects a faulty situation in the body.
Oh, I understand. You mentioned a few treatments there, but I'm sure there are many more treatments that we can do with stem cells, right?
Yes, yes, we can treat a host of conditions. So anything from sports injuries, arthritis, degenerative arthritis. So in these cases, there might be damaged cartilage, there may be damaged tendons, ligaments, and then we treat autoimmune diseases, like I mentioned earlier, where like diabetes, rheumatoid arthritis, multiple sclerosis, all of those are conditions where the body creates antibodies to attack itself. So we treat those kinds of conditions. We treat eye conditions, right, like retinitis pigmentosa, macular degeneration, optic nerve injuries of various drusen of the optic nerve, various different eye conditions, skin and skin conditions and scarring and even just anti-aging. We treat at cellular level as well as stroke and spinal cord injuries. Autism is a very popular one with us also. So we treat almost any condition that will respond to the stem cells.
Also, sexual dysfunction.
Absolutely. Thank you for adding that. That is also a very popular one for us with women and men.
How long do usually treatments last? Or
Good question again, because the actual treatments last up to 3 months. But when you come for treatment to the Stem Cell Healing Institute, we need you here for about 7 to 10 days. And we do all of the treatment, and then you go home. There's a pre-treatment protocol where we start with some just some key dietary changes and additions to the diet and supplements, key supplements. That starts about a month before. And then about 2 months after treatment, you continue with certain key supplements that we provide you with, growth hormone if that is necessary for the condition we're treating, as well as oxygen therapy that you do while you're here, and also you can possibly continue at home. So the whole treatment lasts about 3 months.
and I heard it can also work for cosmetic like facelift and
Absolutely. So it's like the non-surgical facelift where
exactly.
the stem cells are injected into the skin as well as IV. So it's working everywhere that the blood flows, as well as locally right in the skin of the face and the neck, where it goes in and literally builds the collagen and elastin that's been broken down over time. And because of sun damage or smoking or environment or diet or whatever the case may be, normal wear and tear, and it goes in and builds up the skin from the inside out.
And for
So,
the
yep, that is our stem cell facelift.
and also for people like me, that are going bald.
Yes, hair. We do a lot of hair and scalp treatments where it basically the stem cells go in and regenerate damaged follicles or inactive hair follicles and stimulate hair growth. Absolutely. And the good thing about our approach is we're very comprehensive. We address any deficiencies in diet, such as iron. In many cases, there are iron deficiencies or hormone issues, and stress and lifestyle. So it's really important that we cover all of the bases and leave no stones unturned in the treatment, because we want the best possible results. So along with the stem cell treatment, we cover all of our bases.
Wow, that really sounds very promising. But people are wondering how much would this cost, like the treatments from start to finish.
That's a good question. So we do, depending on the condition being treated, as well as everything involved for the stay, as well as the complete comprehensive treatment that I mentioned. By the way, we do a total detox included in everything that I mentioned, with oxygen therapy, growth hormone therapy if necessary, as well as the post-treatment protocol. Everything can run between $13,000 to about $18,000, and that is all inclusive. So we cover everything, so that there's nothing that's left out.
That's so important, so people can have like an idea of a budget to come to Guatemala. This is in Guatemala City, right?
Yes, that's correct.
Okay.
And it's a beautiful destination spot because we have Antigua, which is a UNESCO World Heritage uh,
City.
uh, city, as well as all of the volcanoes and the coffee farms and the ruins. So it's a very touristic destination also.
Great. Well, where can people contact you, doctor?
Great, thank you. Yes, they can contact us at info@stemcellhealinginstitute.com, as well as they can visit us on Facebook and Instagram. And we look forward to hearing from you.
Sure. Our website is stemcellhealinginstitute.com in case you want to see all the treatments that we do. And it was nice having you once again here, doctor.
Thank you so much, Louise. Thank you for having me. Have a
And,
beautiful weekend.
and you too. You take care.
You too.